Hi everyone, welcome back to my YouTube channel and today we are going to talk about black hairy tongue. So let's start our topic with introduction. Black hairy tongue is a benign oral condition where dorsal surface of tongue develops a dark hairy appearance. It happens due to elongation of filiform papilla with trapped debris, bacteria, fungi and pigments. Despite looking alarming, it is usually asymptomatic and self-limiting. Causes and risk factor. Black hairy tongue occur when normal tongue desquamation is disrupted. Common factors include lifestyle habits that include smoking and tobacco use, excessive coffee or tea consumption, poor oral hygiene and alcohol intake. Second factor is medication that include antibiotics like tetracycline and penicillin, chemotherapy drugs and drugs causing dry mouth, that is xerostomia. Third factor is medical condition that include dehydration, HIV or AIDS or immunosuppression, radiation therapy and diabetes mellitus. Then there are other factors that include mouth breathing and dry oral environment. Pathophysiology of black hairy tongue. Filiform papilla normally shed keratin regularly. In case of black hairy tongue, desquamation is delayed, causing elongated papillae. Microorganisms that are chromogenic bacteria or fungi stick to the papilla, producing black, brown, or green pigments. Clinical features of black hairy tongue. Appearance is black, brown, yellow, or green hairy dorsal tongue. Its symptoms are usually asymptomatic and it may cause mild gagging, bad taste, and halitosis. Disruption, it is usually midline and posterior dorsum of the tongue. Diagnosis of black haired tongue include clinical inspection, that is visual inspection that show elongated pigmented filiform papilla. It is check oral hygiene and lifestyle. Second is lab test, that is culture for candida if fungal overgrowth is suspected. Then there are differential diagnoses that include oral hairy leukoplakia, drug-induced pigmentation, melanocytic macules, pseudomembranous candidiasis. Management of black hairy tongue include conservative measures that include oral hygiene, tongue brushing or scraping, and stop smoking and tobacco. Third is to reduce coffee or tea, and fourth is drink plenty of water. Second strategy for management is medical therapy that include antifungals if secondary candida is present, and to adjust medication if they are contributing to black hairy tongue. Third strategy of management is patient education, that is to ensure that black hairy tongue is benign and self-limiting, and to encourage regular tongue cleaning. Prognosis of black hairy tongue is excellent and resolved when causative factors are removed. Recurrence is possible if habits persist and there is no risk of cancer. Prevention of black hairy tongue, it is done by maintaining good oral hygiene, by tongue brushing or scraping, to avoid tobacco, excessive coffee or tea, to stay hydrated and for the regular dental checkups. Conclusion of this lecture video. Black hairy tongue is a harmless but visually striking condition. It occurs due to elongated filiform papillae trapping pigment reproducing microorganisms. Improving oral hygiene, removing predisposing factors, and reassurance are the mainstay of treatment. And this was all about black hairy tongue. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.